The following segment is sponsored by Charleston Oncology. We are here with Charleston Oncology, and I'm joined by Dr. Shelly Shan to remind you at home why it is so important to schedule that mammogram. Dr. Shan, thank you for having us.
Thank you so much for having me.
I know, I schedule mine annually. It's crucial, but there's science behind it. You can detect things early with these mammograms, right?
Right, so annual mammograms are very important because they are going to pick up an abnormality in the breast sooner, in most cases, than a woman will be able to feel it on her own.
And so what are the sooner that you get it, I imagine treatment can be far more effective.
Yes, so we know that the earlier we detect it, so the smaller the tumor size, the more favorable the outcome will be in most cases.
Okay, so let's say someone is diagnosed with breast cancer. Walk me through that process. What are the next steps?
So you'll have a biopsy, you'll receive the results, and then typically you're going to be referred to a breast surgeon and possibly a medical oncologist like myself.
Okay, so how do you determine the steps for treatment? Because so much has changed. I've had so many friends diagnosed recently, but I am shocked by the technology and the different options that you have nowadays.
Right, so it's not a one-size-fits-all. So there are many different subtypes of breast cancer, and because of that, the approach to the treatment is different. So you really need to talk with your doctor about what steps are going to be done first, such as surgery. Sometimes we give treatment before surgery, and some patients need radiation and some don't. So it's very dependent on the patient and their set of circumstances.
Right, so you would analyze what type they have, what the next steps are. Why do women choose Charleston Oncology as their partner and to go through this difficult time?
So Charleston Oncology has a set of amazing physicians here who are all very well trained. We take a multidisciplinary approach to breast cancer treatment. So we work with breast surgeons and radiation oncologists. We present our cases in a multidisciplinary tumor board. Patients have access to clinical trials, and they're able to receive their care in multiple locations which are closer to home.
That's great. You mentioned clinical trials. Where do those fit in, the new technology?
So oftentimes these are, for patients who are receiving treatment before surgery, and they're newer drugs that are not yet available on label. So it's a way to get access to newer, highly effective drugs when they're not yet approved.
All right. For someone watching right now who says, you know what, I am overdue, I need to book that mammogram, what are the first steps to go ahead and do this with Charleston Oncology?
So if you want to call your primary care provider, or even your OBGYN, either of those doctors can easily place an order for you to get a mammogram. It's never too late. Just because you're a little late or maybe years late, don't let that stop you. Just do it.
Right. Is there anything else you'd like to add before we go?
I would just like to say that everyone should take mammograms seriously because 1 in 8 women will be affected by breast cancer or diagnosed with breast cancer, and most of the women I treat with breast cancer do not have a family history. So not having a family history of breast cancer does not mean you are safe. Okay. So just being a woman puts you at significant risk, so please get your mammograms.
Thank you for your time today. I think it's so important to get this message out, and for everyone at home, all you have to do is go to charlestononcology.com for more information. And we're going to take a break. We've got more Lowcountry Live right after this.